Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and I am super excited about our show today. As always, the show is only interesting if we have someone, a patient, a dear friend who will help us through this journey. We are blessed to have a dear friend and patient of mine who is going to help us navigate the idea of explantation. It's a super hot topic. Anyone who's considering contemplating breast augmentation has heard of things like BII, explantation, capsulectomy, and these are terms that are very confusing. Breast lifts, fat transfer. Well, we're gonna address all of that today, but this time through the eyes and the experience of our patient, Raina. So welcome to the show, Raina, and thank you for coming. We appreciate it. It's I'm very excited that you're here and grateful because shows don't exist without you. I mean, literally, anyone who knows anything about me knows that I can just talk about anything at any time.
True.
But that's not as exciting as having this banter and dialogue, not only because you're interesting to talk to, but you had this experience. And through your willingness and vulnerability, we're going to discover a lot of information, and I think people are going to really appreciate it. So let's go ahead and start with your journey. Tell us basically, when was the first time that you had breast surgery? And if you can, take us through what it is that you end up doing and why you ended up doing it in the first place.
Well, as you know, I have two sons, 19 and 14 now, but my younger son, I breastfed for 17 months, and I was left with basically the equivalent of two empty bean bags that you would play a game of cornhole with. There just wasn't much to my breasts any longer, and they hung low, and they felt like they didn't belong to me anymore.
And you're obviously really fit, very thin. You've always been very lean. So I imagine you didn't have much breast tissue prior to breastfeeding, let alone afterwards, right?
No, I certainly didn't.
Okay.
But I decided to explore, what are my options? A breast lift? I really didn't know.
Right.
So I met with a few surgeons in Los Angeles. There's a lot of great surgeons here. And I decided on one, and I was informed that I could have a breast lift, but probably wouldn't have the volume in the upper portion of my bra, and I should probably consider a small implant. I was fine with it. My husband was over the moon about it.
And this was, now we're talking...
This was...
14 years ago.
No, this was 11 years ago.
11 years
right,
ago.
11 years ago. And I decided to do it. And had the lift, had the small implant put in, and went on my way. And once I was cleared to start exercising again, I did a lot of yoga back then. And anytime I would go into any position that would engage my pectoral muscles, I noticed that my left breast drifted.
Sure.
I watched it drifted to the left anytime I engaged my arms. And it was disturbing and kind of weird, and I was a little scared. Went back to the surgeon and was informed that I could be taken care of with some sort of a piece of mesh. And I said, okay. And I underwent another surgery and healed from that, started exercising again, and the same thing happened.
Sure.
And I was done. I don't want anyone to touch me anymore, touch my body anymore. I was fine. You get what you get. You don't get upset. And that was it. I went about my life.
Right.
And fast forward, I would say probably 9 years later, I go for an annual mammogram and ultrasound.
Right.
Because with breast implants, I was told you just want that extra layer of protection when you're looking for breast cancer. And during my last mammogram, which was a little under a year ago, I was informed that one of my breast implants had encapsulated and a capsulature, I believe.
Yeah, capsular contracture.
And so visually, it looked like my right breast was maybe 1.5 inches higher, and it was up into my upper chest area, just not where they're supposed to be.
Right, exactly.
There was nothing natural about it. And you could look at me from one side, you're like, hey, that looks great. And you look from the other side, and it looks like I just swallowed something, and it was bizarre. Additionally, I was at risk for rupturing, which is scary. There's silicone. I don't want that to happen. So I decided to explore my options.
Okay. So let's go back into a couple of things. So the first thing that we want to touch on is the idea that about needing or not needing the implant. I don't think that the individual, as long as you are informed about it, I think the key is to have the information. So I would have advised you probably the same, which is here you are, a lovely, beautiful lady coming to me with two issues at hand. One is my breasts have sort of lost volume, And the other is they've also started to sag. And the sag part is addressed with the lift, aka removing the excess skin. And the volume part can only really be addressed by adding volume. We're going to forget about fat transfer because everyone loves the concept. You're not even a candidate because you're so lean. But the idea is that I have to add volume. So if you have a patient, and you would be that patient, who doesn't have a lot of their own volume, if you do a lift, it's going to be incredibly underwhelming. So much so that you'll probably wish you didn't have the lift, because now I still have basically nothing, except now I have a bunch of scars in exchange. And granted, your breast will sit a little better. You'll have essentially no volume to your breast such that you will look fuller in any way. The assumption is if I'm look fuller, porn star. No, we have 140 cc implants. They're that big. They're literally the size of a small donut. So it doesn't mean that you need to be huge. And I think the idea of doing a lift with an implant was a correct one. Whether or not that's executed correctly, that's a whole different animal. The second thing you were talking about, which was when I would activate these implant, especially the one on the left, would shift all the way to the right, that's called something called animation deformity. And a small amount of it is normal, right? The implants should go under the muscle. So therefore, when you fire your muscle, especially downward dog, bench press, flies, that muscle will fire. That muscle will then tighten, and that implant will then move. That's normal. But what you were experiencing is more than just animation deformity. What you were experiencing is that pocket was not correctly dissected. And so when it would move, it would bulge abnormally in certain places more than others. So that's the second thing. The third thing is this idea of capsular contracture, which unfortunately still is sort of the arch nemesis of breast implants. And essentially what it is that for whatever reasons, every person who has an implant in their body makes scar tissue around it. It doesn't matter what the implant is. Prosthetic knee, heart valve, pacemaker, your body is going to say, oh, this thing doesn't belong here, and make a shell around it and protect you from it. And that shell is normally thin and you don't care and you go live your life. Some people and some bodies tend to start making a thicker, more voracious scar tissue, which is not dangerous. It's not going to kill you. It's just going to annoy you because it's going to start changing the shape of this perfectly round structure. And they first tend to notice is like, holy shit, this one's all the way up here. How did it get up here? And then, this is so much harder than this one. And that's because of the squeezing effect of that capsule. When did you start noticing that when you looked in the mirror and you're like, whoa, this doesn't look right? When did that start happening?
It was gradual. I mean, there were many years I was extraordinarily happy with the implants. I really was.
Perfect.
I lived with the animation deformity, and I just sort of went about, but I was happy. I was definitely happy. I felt the volume. I felt very feminine. I would say probably 8.5, 9 years in.
Okay, great. So it was towards the end that started happening. All right, so now we fast forward. Here you are. You did your ultrasound. You did your mammogram. They're telling you that it might be ruptured, maybe not. In addition, just flat out, you're looking at yourself and you're like, now there's a decent amount of asymmetry, and it's very hard to hide asymmetry.
Yes.
That is the number one complaint that I have when people come to my practice. It isn't even so much that it's hard or I don't like the shape. It's I can't conceal this asymmetry. And so you then decided to have to do something about it. Your sort of hand was forced to do something. Albeit around 10 to 15 years, you probably should have changed the implants anyways. So you got a good longevity out of your first surgery.
Got a good run.
Okay, so now here you are, you have to go about it. So take me through what you do now with these three things in place. Animation deformity, right? Capsular contracture, and breast asymmetry. So tell me what you do.
Still living in Los Angeles, I have, access to amazing surgeons everywhere. I started asking around, did some research, and I met with two other very reputable surgeons, one of whom specializes in breast reconstruction. So I thought, this has got to be the way to go. And it was a woman. So that was a different even level of understanding and empathy. And the response I got from both of these surgeons separately was very similar, which was, no problem, you've got a capsular contracture, we can explant your implants and fix the capsule. As far as the animation, we can put some mesh in there, and I don't even know how else they described it, and then we can put new implants back in, and off you go. That wasn't ideal for me, not because I was against implants, but because, well, if I already created a capsule once, why wouldn't I just do it again?
Sure.
And maybe this time sooner. And I just don't want to do that. So my end goal was, in addition to feeling good and keeping my body healthy and safe, was to not necessarily have to have implants.
Right. So let's talk about size in general. So there's the issues associated with the implants, which you eloquently said. It's like, hey, I made this capsule before. What's to say I won't make it again? And the truth of the matter is that there is nothing to say that you won't make it again. It is a risk, and albeit it took 8 years or so, you could develop it again. But let's just talk about sheer size. Do you remember what size implant was there originally?
Well, okay, so I had two separate sizes because I had natural asymmetry to begin with. I want to say it was like a 180 and a 210.
Okay,
I'm
so
not exactly sure.
180, 210, it sounds about right. And in general, those are very small implants. However, it's all relative. And on your tiny little frame, which is very thin and you don't have a lot of volume on your chest, 180, 210 may seem much larger than perhaps even what you like. So if you take size alone, forget about all the other issues. My understanding is that you want it to be smaller in general. You liked that look of just smaller, yes?
Yes, I like that look of smaller, and also because of where my implants sat in my body, not just the one that was encapsulated, it looked messy. Like if I wore a tank top, I just, I felt very self-conscious.
Got it. So, okay, so then you and I meet, and you come to see me. The things that I picked up on when I met you, I think the biggest element of all the things that you're talking about for me was the asymmetry. It wasn't that they were big, it wasn't that they were small, it wasn't even that both breasts were high. It was that your right and left breasts were far enough separated in terms of differences in the way they look that I could imagine that it would become very cumbersome to dress. And you always dress elegant, and I can only imagine trying to conceal that. So to me, that was the biggest element. So we chatted, right? And we talked. And what did I tell you regarding the idea? What did I tell you? What did we decide?
So first of all, when I met you, it was the most refreshing thing because I didn't yet know we had a dear friend in common, but you had said to me, I can't make you any promises that you're not going to walk out of here and look perfect. That is, I can promise you that. I am going to tell you what I can do. And you were so honest with me, and you looked at me, you told me exactly medically what was going on, capsular contracture, animated deformity, and that you would go in, we'd do a lift, you'd fix the capsule, and, there's a chance we'd do implants again. And otherwise, if I can salvage what breast tissue you have, I'll try to do that too. You were very honest. It was sort of like, let's just get in there and see. And that gave me, in addition to giving me a lot of comfort because you were just very, very honest, it gave me some hope too, which was an exciting feeling. Just to know that there's a chance that I could get away with having the look that I wanted overall, which was not necessarily anti-implant, but just smaller, more petite, and more fitting of my body.
Sure. So the way I approach, so explant is a tough topic for me as a surgeon, and it's a hot topic now because we have this ebb and flows in plastic surgery, and implants in plastic surgery are a buzzword. They're a hot topic because there's a really strong divide, and there is a large subset of individuals. They don't make up a large number of individuals, but they make up a very vocal number of individuals who have issues with implants, just like people have issues with hip prosthesis. My wife had issues with her spine hardware. They're implants, they're foreign devices, and there's a large substantial number of people who have a general condition called BII, or breast implant illness. And essentially what that is, and nobody knows yet, and maybe in 5 years and 10 years and 20 years we'll know exactly what that is, but the way I see it is as follows. When an implant goes in your body knows it doesn't belong there. It knows that that's not a human tissue, and it will separate that tissue from your body and protect you from it and wall it off and make scar tissue around it, and that's the capsule that every human being has. In the overwhelming majority of people, that process is finite. It makes the scar tissue and then it calls it a day. But I believe in the people who have BII, their bodies are continuously trying to manage this thing. It's like it's constantly sending in the troops. And like a computer, the hard drive is on overdrive, and therefore things are running slow in the background. So they're developing symptoms like fatigue, hair loss, muscle joint pain, and things of that nature, which we would call constitutional symptoms. They don't feel well. So that's not a new topic. That's been around for a long time, and then it kind of disappeared, and now it's come up again. And social media is a very big driving force. Right. So what's happening now in plastic surgery is we're having a sizable number of people coming to us saying, hey, I want my implants out. No problem. I have no problem with that. But simultaneously, they want to look good. And so the problem that at least I'm facing is I want to honor the patient's wishes of wanting the explant. It's not my body. You can do a mastectomy if you want. At the same time, I know as the surgeon, I know as the artist, I know as a person that's in surgery that they may not have sufficient breast tissue to create anything that would be arguably attractive. Mm-hmm. And that's a real problem because I believe that they may not fully understand what they're asking for. Now, my sister had breast cancer. My sister had a double mastectomy. You had to. Like, you have no breast, you do, because you were dying of this disease. And if your illness is so strong that you don't care what you look like, I understand. But in the milieu of people coming in asking for explants are a lot of women who don't really have BII. And they're sort of just getting swept into this, the current of implants are bad. Mind you, now the overwhelming majority of people in the world who have implants love their breast implants. So this is a small subset. So my concern with you, and the reason why I was so honest with you, is because you are so lean, you are so fit. And what was I worried about? I was worried that I'd take out your 2 breast implants, I'd do the capsulectomy, fix and then I would go to do a lift and be like, wow, there's nothing here or not sufficient here whereby which I feel, and at the end of the day, you're asleep, that you would feel comfortable, attractive. Because if I told you I'll fix everything, but you get a mastectomy, would you sign up for that?
No.
You wouldn't. You just wouldn't sign up for it. Yes, I don't like this asymmetry. Yes, I don't like anything about this, but this is better than a mastectomy. So I try to fight that fight on behalf of patients. And what I always offer them is, which what I would want someone to offer my wife is, I'm going to go in and I'm going to definitely die trying. And if I feel like it's acceptable, that you understand it's not going to look like a supermodel, but it's acceptable, I absolutely will explant you. However, if I take out the implant and I'm like, wow, that doesn't look good at all. What do you want me to do? You want me to leave you like that? And most patients who are not in the true BII category, illness-wise, are like, well, I want the smallest implant you can give me, because their concern is that they don't want to live that lifestyle they used to. They've outgrown it. Implants was great then, but not now. So we're going to take a quick break. We're going to come back, and then let's talk about what we did end up doing.
Absolutely.
And then we're going to talk a little about what your advice is moving forward on how to navigate this. If you are at home listening and you are in that, I consider it 3 categories. I love my breast implants. I have BII and I don't give a shit. I want them out, and I'm in the middle, and I think I want to go smaller. I want to get rid of them, but I don't know. So I want you and I are going to talk to those people in the middle here. Let's take a quick break. We'll be right back with the second half of Plastic Surgery Uncensored. Welcome back to the second half of Plastic Surgery Uncensored. All right, so Raina and I are digging in, and I know all of you have been at the edge of your seat. So Raina, you go into surgery, you go to sleep, you wake up, and what happened?
Wow. First of all, this is one of my favorite parts of this whole experience I had with you. So, I didn't see you after. I know the surgery went well, I was told. I don't remember much. I go home. Recovery wasn't that bad. The pain wasn't that bad. One thing you made extraordinarily clear to me prior to surgery, which was, do not push, pull anything larger, bigger, heavier than 5 pounds for 6 weeks. I was thrilled. So I really followed your directions.
Correct.
And when I saw you for the first follow-up appointment, I had bandages, I had a special bra, I couldn't shower, that was rough. I saw you a week later. I come in, you took off the bra, you took off the bandages, you asked me to stand in front of the mirror, and I remember looking and I was blown away. They were pretty damn symmetrical, I have to say. I mean, I was extraordinarily impressed. They were lifted, they were shaped like a breast. I mean, they looked from each side One wasn't significantly higher or harder than the other. And you looked at me. Now, by the way, I had no idea. And you looked at me and you said, I didn't think we'd be able to do it, but I got in there and you had enough breast tissue. At this point, I did not know I didn't have an implant.
Right.
So I was wet, and you said, yeah, no. And I don't even know if you thought I knew, but I didn't know.
I thought you did know.
Yeah,
Because,
I did not.
Yeah.
I did not know. So I was extraordinarily happy. I left here, still couldn't drive, and I, standing right outside, waiting for my husband, I called him and I said, I don't want to curse. I don't think I'm allowed to curse, but if I were, there would be.
Oh, you're allowed to curse.
Okay.
This is Plastic Surgery Uncensored.
Okay, then wonderful, because I am uncensored. And I called my husband, his name is David. I said, David, honey, you're not fucking gonna believe this. And he's like, what? I said, I don't have an implant. Because, long pause. Yes. Did he forget? And I'm like, no, he didn't forget. And then and he was so happy because he knew my goal was not necessarily not to have implants, but to have a look that fit my body.
Yeah,
and the fact that it was achieved without an implant,
Even better.
even better.
Absolutely. Absolutely.
So I was thrilled. He was surprised. It was pretty funny, the overall experience. But I was so happy. I was happy with the look. I was happy with the feel. I already felt better, even wearing, the cotton bra that has 11 snaps in the front. But with a tank top, I didn't have to worry about concealing what I always did.
Sure.
Those turtlenecks went to the back of my closet.
Yeah, and for me, the most powerful part of that was the idea that, here you are, this beautiful lady, you always dress elegant every time I see you. And then when I would see you in the office and I saw that what you were managing, I have this sort of, I'm not a woman, so but my wife is an elegant woman, likes to dress. She takes so much joy in being able to adorn herself with the clothing that represents what she likes. And when you're dealing with this thing underneath that no one knows, and I can only imagine how many of your girlfriends actually knew what your breasts look like towards the end and sort of the asymmetries and what it's like during intimacy and all those things. That's for me a very powerful feeling, even though I'm a man, because I know that for women, for men, their hair is a very big symbol of who they are. And when you lose it, it's a really big deal. And for women, their breast is a very big symbol of their own femininity and how they connect to their own sexuality. And so it was a great feeling to be able to not only create breasts that were like beautiful and symmetrical and all those things, but one that was congruent with what you thought would look good on you, right? Not what I thought or your husband did or whatever, but you did. And the truth of the matter is, as interesting as it is, you had gained some breast tissue, which is not the case then prior, because some women, as they get older, they lose breast tissue, and some women, in your instance, as a result of, I think it was your second child, gained some breast tissue. So you had not a lot, but you had something there. And so nothing makes me happier. But the key to this was that you were open to the possibility of, if I need it, then fine, do what you need to do. And for me as a surgeon, that's the only patient I'm going to operate on. Because had you said to me, no, I don't want an implant under any circumstances, but they got to look pretty, I wouldn't do your surgery.
I know.
Because you then create a scenario that's not winnable. I have done the surgery and I have told patients they will not look pretty, and they have signed a consent that says, I understand that my breasts will not look attractive and I'm happy to help you in your journey. But if you want me to do your surgery and then you're going to hold me accountable for the way they look and you're not letting me do what I need to do, well, then we can't do this dance. So you allowed us to do that journey, and your openness was very, very important, because some people are very obstinate about their wants and they just think that plastic surgery is magic, and it's not.
No.
So now that you're in how long ago was our surgery?
It was March of 2023. Not
So
that long ago.
we're talking about 6 months.
6 months.
So you're well into the rhythm of your life.
Yeah, absolutely.
Right? You get to wear what you want. You're going to the gym. You are now this new person, right? And you recall just 6 months ago not being that person.
Yes.
How has this impacted your life in the different categories?
Wow. Well, in addition to being able to not have to plan out what I'm going to wear, which was a very typical occurrence for me, I felt like obscene looking before. I wore anything that was not even low cut because I don't wear a low cut, but anything that was too form fitting, I was very self-conscious. And I mean, I feel great. I feel like I don't have to think about it, is the truth. There's no planning, so I don't think about it.
Right. That is a very powerful statement, which is I stopped thinking about my breast. My life doesn't revolve around my breast anymore.
No.
In the instance of intimacy, was there ever an issue regarding that?
I felt
Well,
an issue.
Well, that's all that matters. Men don't, like, I talk about this every single time. Men don't care. No. They care when you care.
Yes, because that comes through.
Right.
In how you relate sexually, how you feel about your sexuality. Yeah, I was self-conscious. I would definitely, try to wear something or...
Right.
And then if my husband were to remove that, I'd be like, excuse me. So,
right.
Or I didn't want to necessarily, certain positions. If I were laying flat, I was really self-conscious.
And has that, and is I'm assuming that you don't think about it there either during intimacy.
No, definitely not.
I think that's fucking amazing.
It's pretty
such
great.
a critical moment in our beings. Right? Intimacy is one of those little areas where you're in a very special space in life when you're intimate with someone, and to be fully free during intimacy versus conscious during intimacy is like two different experiences altogether. So that, I think, is just says it all, and it's so phenomenal. So if I'm at home and I'm, as I said to you, there's three categories. There's people who have no issue with implants. Great. Okay, fine. There's people who under no circumstances want the implant. If they have it, they want it out. They don't care what they look like. Fine. But then there's a large subset of individuals who are living in this sort of limbo. That limbo is, I'm neither here nor there. I don't love my breast. I don't hate my implants. I'm just sort of not happy with my breast. And the breasts then bleed into my intimacy, what I wear, and so on and so forth. So if I'm a woman and I'm listening and I'm that middle category, what are some of the advices and suggestions and your experience? They're like, wow, if I could have done this earlier. What are the things that you think of when you're advising friends now regarding their middle, where they're stuck in the middle?
Well, first of all, I just want to say to you, I do agree that the voices that tend to be the loudest are people with grievances, about, and I believe in, breast implant illness, but I also think that typically, and I don't know if this is always true, but there's some sort of autoimmune issue going on just in general. And so I think that if you believe you have breast implant illness, that's something that you should explore first and see if you actually have any sort of autoimmune issues going on, because if you've been okay for a really, really long time with your implants, I don't know if it necessarily comes out of nowhere. I don't know.
And the truth is that the reality is that we don't know enough to know.
No.
And all I know is if you feel adamant that you want them out, knock yourself out.
Course.
Just like there are people now getting mastectomies who want to transition into being a man. I'm not here to question you or judge you. But there are that middle group of people who don't hate their implants because they're implants,
right,
but then are stuck and they're not happy with the way they look, and then they're afraid of moving that direction. So, what would you suggest?
I would suggest first figuring out for yourself what's important. What are my goals? Are my goals to just at any cost sort of have them removed and or fixed so that you don't have to even think about any sort of potential rupture and or anything, but aesthetically is what they look like is not as important. I just think you have to figure out what your goals are. In my case, I wanted them to look feminine and sexy and like me. So once I knew that, once I had that established, and I met with different surgeons, I think you need to ask that question. And I think, honestly, there's only one answer. There's no definitive answer. There's one answer, which is, well, let's wait and see. You cannot tell, I don't think, how much breast tissue a person actually has, what you'll be left with until you're in there. And so that kind of trust between you and your physician is really important.
Yeah, and I think you hit it on the head. I mean, I think that the reality is that, what I've experienced, because I've done this a lot, is that I tend to operate on the people who are just like you, which is, hey, here are my wants. What's your wants? My wants is I want them to be more, notice the word more, right, symmetrical, right, not the word symmetrical, right? It's an anomaly that we got you as symmetrical as we did because you started out so asymmetrical. But the goal was to get you as symmetrical as possible. I'd like to be smaller, and I'd like not to have an implant if I can. And the if is predicated around, well, if you, the surgeon, the person I selected, feel that it's ugly, please put in the implant that would make me still look feminine, but why don't you, I want it to be no bigger than this. And when a patient is open to that, then I can go in and do what I need to do, because then I know that I have wiggle room. And so to me, I think that that's really critical, and that you have to, as a patient, be sure that you pick a side. What you can't do, and I've reiterated on many occasions, is insist that you want the implants out because you're just over it, and then demand that at the same time you want it to look beautiful and feminine, because there's a misunderstanding. The misunderstanding is that a breast lift, and now even worsened by the fact of fat transfer, a breast lift in and of itself is going to do the magic. No, it will not. If you have no breast tissue, no breast lift on the planet is going to do shit.
Right. Yeah.
Furthermore, and worsened by this situation, is this concept of fat transfer. So I'm going to just take a moment here. The idea is that we take out an implant, 200 cc's. That is a small implant, but it is 200 cc's.
Correct.
Times 2, 400 cc's. And I'm going to take out that implant, and then I'm going to replace that implant with some degree of fat. First question, where the hell am I getting it from? Where? Oh, I don't know. They'll get it from my back, my arms, my inner thighs, my love handles, and my abdomen. Okay, great. So if you need 400 cc's of volume, know that about 50% of it dies. So now I need 800 cc's. Know that if you have 800 cc's, that means that when you aspirate and you suck out, half of it is fluid. Now I need 1600 cc's. So all of a sudden, you need a boatload of liposuction. And the problem I have with high volume fat transfer, butt and or breast, not face, is that you cause damage in the areas you borrow to fix the breasts. It's stealing from Paul to pay Peter. And when you're done, Paul is poor. Now, I don't even think Peter's rich. I don't even think the breasts look good after you've done all these hoops. So I'm not a believer of fat transfer to the breast, especially during explantation. You have to be okay with looking whatever you do. Do not be fooled by doctors who will mislead you that they're going to take out your implants and you're going to win-win, and they're going to do lipo and you're going to get fat transfer. Holy shit. This is the most common misconception today, and doctors are making. Listen, doctors are not stupid. They're very smart people. When there's a trend, explantation, they're going to get on that wave. And that wave now is, oh, I'm an expert in explanting. Oh, implants are poison. And then they're going to play on your insecurity regarding your implants. And then they're going to create an answer that is going to be so perfect. So let me understand this. Explant, lift, fat transfer, and I get lipo of the areas that I dislike. Sign me up yesterday.
You were really clear. In fact, I remember asking about fat transfer, which I failed to mention earlier. But you said, no, no. And you shut it down because, well, A, you didn't think I had enough places to borrow, but also you had mentioned that if all of that is done at the same time, a good portion of that fat is just absorbed by the body, so it doesn't
100%.
even remain.
And where is it going to go?
So what's the point?
Right, that whole space that the implant comes out of, you can't put fat in there. There's nothing there. You have to put the fat in the tissue to fill it in the tissue. It has to go into the live area, not the empty hole that's left. It's a pie in the sky that plastic surgeons are doing because so many people want explant and we don't want to lose them. So for every 10 patients who call us, maybe one will come because I'm not sure I can explant you, and they don't want to hear that right now. But there are guys that are advertising left, right, and center, explant, fat transfer, lipo, sign me up. And you will see patient after patient after patient so dissatisfied with the aesthetic outcome. They got the implant out. That part alone will make you happy. But aesthetically, they do not look feminine. They do not look attractive. They are not girly. And I think they didn't expect that. And had you expected that, okay, no problem. Great. You got your implants out. It's as good as it is. No problem. But that's not what they went in being told. Yeah. And I think that's my biggest fear for patients, is this sort of trend of explantation. And then the thing is, I've actually had 2 patients come back to me asking me to put the implants back. Sorry, no go. It's never the same. Once you take that implant out, it isn't like, oh shit, my bad. You just put it back in. That pocket collapses. the space gets obliterated. They've now done a lift. It's a different animal. So it really is a irreversible decision you're making. And so all we wanted to do, and the reason why I'm so grateful that you're here, is that I wanted to highlight this idea because you're in that middle category. And that middle category actually tends to be the majority. Very few people want an implant. Oh, can you sign me up? I want an implant. They need an implant.
Correct.
For a look. So when given the opportunity to get rid of the implant and sold the idea that they can have the look, oh shit.
Sign me up.
Why not?
Absolutely.
Not going to happen. Not going to happen. So, all right. Well, any parting information to anybody who's listening that you're like, God, now that I did this, whether that's from what you did from the beginning, from the minute you decided on this journey, way back when, to now that you're sitting here, if your best friend, your sister wanted to do any of this stuff, what would be some of the nuggets? Because you've now had 3 surgeries regarding your breast, which is not crazy. My wife's had 6 spine surgeries. But you've kind of gone through a very long emotional journey in those 3 surgeries. It isn't like I've had 3 surgeries and I just went in to change and replace my breast, but I've loved them all along. Right. You've had a long period of time in which you've been very dissatisfied. What pieces of nugget would you just impart to anyone who's listening?
I would honestly just say that you need to be open to multiple paths to get to where you want to go, because there isn't only one option, and that you can't be too married to an idea of what you're going to come out looking like. You need to be very realistic. You need to ideally work with a physician that shares that and that you trust.
Yeah, I agree with 100%. I think the problem is the social media has really fucked things up.
Well, that's
so when you say
other podcast.
The reason why I say to you that is because you're saying you want to have realistic expectations. Yeah. When was the last time you looked on social media and you saw anything but perfection?
Realism doesn't sell.
Yeah.
Realism isn't enough to motivate people to necessarily go under the knife. But I am happy to disclose this. I was so excited and happy and grateful for the work that you did with me that I trusted you with my most cherished possession, which is my son.
Yes, of course.
And you did a septorhinoplasty for him, and he looks extraordinary. But one thing you said to him, and he was already, he's only 19.
Yeah.
You looked at him and you said, listen, don't think that I'm the guy that you can come in and I'm going to show you some pictures of what your nose is going to look like on a piece of software. I won't do that. And if you meet anyone that's going to do that, you better run. You were just honest. You're like, I'm going to get your breathing better. I'm going to get it as straight as I can. And I'm going to make you feel a lot better. But I'm not going to give you a perfect nose.
Sure.
And guess what? I mean, you did. You gave him a perfect nose. But you gave him a really great mindset going into it, and therefore coming out of it.
Yeah. No, and I think that's our responsibility, right? Mm-hmm. I mean, it is our job as the professional. It's your lawyer's job as a professional. It's your accountant job. That's why we call them professions. To educate, guide, and show patients the path to their outcome. And that path is not clean and straightforward. It's a little messy. It's surgery. But I do think that when you have the right patient and the right doctor and you select the right procedure and you do and execute it, there's nothing more powerful than the plastic surgery that I do. Nothing. I mean, from your son's experience and that young man's trajectory and being able to breathe and do exercise and now feel confident and getting married and all that to your journey of now feeling whole again. I mean, that stratosphere of experiences of interpersonal relationships, there's nothing like it. So it's pretty spectacular, and a testimony to that is that you're here. You came on a Sunday to spend and share and be exposed and be vulnerable, and we really, really gratefully appreciate that. So with that, that's going to wrap up this show of Plastic Surgery Uncensored. As always, I'm going to ask you 2 things. One, if you like our show, if you love our show, please write something pleasant. I think that people underestimate the power of positivity in terms of words. There's a lot of people involved, the camera crew, the producers, etc. So instead of writing negative things about how much you hated the hotel and the food sucked at this restaurant, go write something positive about the show. And secondly, you have no idea who needs this information. Right. Because by the time you realize that so-and-so who's dear to you went and had something done, it's too late. So if share this podcast with the people you love, because You want them to have, listen, everyone is inclined to the aesthetic world. It's as small as Botox to as great as a mommy makeover. And you're going to want to make sure that the people you love have access to our show prior to having done so. So share, download, and subscribe. As always, thank you very much.
Thank you, my dear. My friend.
We look forward to seeing you and your son at your follow-ups, and more importantly, just socially around, because you become a very dear friend. And as always, we appreciate your time.
Thank you very much.
All right, guys, that wraps up another show of Plastic Surgery Uncensored.